Meeting to order. Meeting to order for the Minnesota Senate Health and Human Services Finance and Policy Committee. It is Thursday, March 5th, and we do have a quorum present. Our first item on the agenda is a presentation by the Minnesota Department of Health. And members, we had a report. The first year of the report came out a year ago, and then this is the second year of the report, and so we wanted to have an update on the report and what the findings were in the second year. So if we could have Mr. Gildemeister and Ms. Stieber. Welcome to the committee.
Good morning, Madam Chair, members of the committee. Thank you for having us. For the record, my name is Stefan Gildemeister. I direct the Health Economics Program at the Department of Health, and I'm the state health economist. And with me today is Annalisa Stieber, who manages our pharmaceutical analysis and research work. Thank you for having us this morning to speak on what seems to be increasingly everyone's favorite subject, both locally and nationally. Just maybe by way of background, the Health Economics Program at the Health Department focuses on health policy and research. We study the healthcare market and aim to understand changes in healthcare cost, quality, and access. And our work is data-driven, so we aim to bring objective research to your deliberations. About the 340B report, it is studying the effect of a federal program, drug pricing program in Minnesota. This program, 340B, named after the federal law, section in federal law was established to financially support eligible provider organizations' safety net functions. This happens in a fairly straightforward way through prescription drug manufacturers being required to provide a discount on outpatient drugs, and then providers can generate a revenue or reduce their losses if they provide drugs for free to patients, because the reimbursement is generally greater than the acquisition cost. So we term this net revenue, but essentially it's an arbitrage between purchasing drugs and being reimbursed for them. Nationally, policy questions really swirl on many issues around the growth of the program, how well it's targeted, the financial incentives it generates, and ultimately how revenues are used. The legislature, the Minnesota legislature, directed us to do this work because you wanted to understand to what extent providers could lose revenue if the state changed how it managed the Medicaid prescription drug benefit. So that brought us to the study. We did an analysis, as you mentioned, Madam Chair, last year and presented it to your committee. This is the second year. The data are more comprehensive, so I think we're able to provide you a more complete picture. Annalisa?
Thank you. I am Annalisa.
Welcome to the committee, and if you can please state your name for the record, and you can begin.
Thank you, Madam Chair. Annalisa Stieber. I work in the Health Economics Program and lead the team that managed this report, the data collection and producing the report. So we are going to begin with just a little bit of a background on 340B to give a baseline. So to start, a few things that are directly related to 340B or the federal program. So it specifies under federal law which providers may participate, and under the program these are referred to as covered entities. It includes both generally hospitals and clinics, and it also prescribes, again, 340B, which associated sites can be part of that network for that covered entity. Generally, this is going to include off-site clinics, outpatient clinics associated with a hospital that could then also be participating with that covered entity. It also specifies pharmacies that can enter into contracts with that covered entity and also dispense prescriptions that would be considered a 340B transaction. The 340B relates to specifically like which prescriptions apply. So that is the level that we are talking about for 340B or not 340B. And again, this is directed in federal law and rule. So which patients are eligible, and then also preventing duplicate discounts. So you cannot take a discount on more than one discount on the same prescription at the prescription level. And so this is generally with the Medicaid drug rebate program is the most likely place where you might have two instances of a discount on a single prescription. The last area that the 340B program really directly interacts with is the price, the acquisition price. This is set, there's a ceiling price or an upper limit on the price set in federal statute. It's a formula, and this is the price that the provider pays to the drug manufacturer for a 340B prescription. Finally, a note on things that 340B does not directly impact. It certainly influences, and there's a lot of interconnectedness, but does not directly impact how a provider might use revenues generated through the 340B program, the reimbursement rates paid by any payer or the patient, what they pay at the counter, how pharmacy networks are designated, and so on, and that list gets quite long. A little bit of a baseline just for some reference point in understanding prices. So the 340B acquisition price, also sometimes referred to as the ceiling price, is generally going to be lower than what a provider could purchase that drug for outside of the 340B program, normally negotiated through a group purchasing organization, which is then going to be lower than the list price that the manufacturer sets. And this is what allows a provider to essentially buy low, sell high, as we've mentioned. Finally, a little bit walk through a couple scenarios just to give you a flavor for how the 340B works. This is simplified, but hopefully should give, again, a sense of how these revenues are generated. So in the left-hand table, you can imagine a drug costing $100 if you were not purchasing that, if it was not a 340B prescription. But with 340B, you would get a discount, in this case 40%, so it's $60. The reimbursement, whether that's paid by the payer, the patient, or both, is $100 in both cases. That does not change. Note there would be some operating costs for 340B for tracking the operations and managing all of it. And then when you net it all out, without 340B in this instance is $0. We don't know if that's the case, but that's how we've laid it out here for reference. But with the 340B program, you net a revenue of $36 on that prescription fill. So that would be an example of generating revenue. On the right-hand side, there are some instances where 340B helps a provider essentially reduce a loss. This is when they're providing medications for free or at reduced cost. So here, same $100 drug, same discounted 340B price, but no payment received. And without 340B, this provider would have a loss of the full cost of the drug being $100. But with 340B, their loss is only $64, which is less than it would have been otherwise. Moving into some findings from our report, start with an overview of providers in Minnesota. So who are we talking about when we talk about the 340B program in Minnesota? There are, or in 2024, there were 204 covered entities in the state, roughly half hospitals, half clinics, and you can see we've grouped them into 5 different categories here. But the reach of these providers under the 340B program is much larger. They do this by using child sites, that's the 340B term, but again, they're mostly outpatient clinics. And you can see there's over 1,000 of those in the state for those 204 covered entities. They also have nearly 2,500 contracts with pharmacies. These are, and this can be a many-to-many relationship. A single covered entity might have multiple contracts with multiple pharmacies, and a single pharmacy may have contracts with multiple covered entities. Again, expanding the reach of the program. And of note, about half of those pharmacies are not in Minnesota. So another way to kind of, it goes beyond our borders. The report includes data from 181 covered entities. The reporting rate was extremely high, but there were 17 covered entities that had no 340B transactions in 2024. They have a covered entity status, but didn't have any transactions, and so we excluded those from these findings. All right, top line numbers. The reporting is aggregate, so we pull this all in, and when we look at all covered entities in the state, collectively in 2024, they spent about $1.5 billion on 340B drugs, spent roughly $165 million to operate their 340B programs. That's internal costs and payments to contract pharmacies and any other external entity, such as a third-party administrator. For those prescriptions, they were reimbursed about $3 billion, and that's what would be paid by the patients through copays or coinsurance, plus reimbursements from any payers or other cash payments, all of that. When you net that out, we get to the net revenue statewide of $1.34 billion under the 340B program in 2024. So what's behind this? Again, statewide net revenue of $1.34 billion. This is roughly double what we saw in the first year reporting. But most notably, we don't have the same collection of data. It was different sets of, the second year was more complete. The first year we had incomplete data on administered drugs, office administered drugs. So these are outpatient prescriptions that need to have a healthcare professional help administer them. Think cancer treatments, infusions, things like that. They were partially reported in the first year, but more completely reported in the second year, which largely accounts for that increase between the 2 years. And that is both count of prescriptions, so the more complete universe, and office-administered drugs tend to be more expensive and so drive higher net revenues across the board. The increase likely also reflects some program growth. We can't trace exactly what the program growth in Minnesota has been, but national numbers show that the program has grown over 22% year over year in recent history. We also have some drug level data from the hospitals that shows that a large amount of the revenue is generated by so-called specialty drugs. No firm definition of what a specialty drug is, but they tend to be biologics, administered drugs, high-cost specialty drugs. Finally, we see that the general acute care hospitals account for 80% of the net revenue in the state. All right, so there's a lot here, but this is the same groupings of covered entities that you've seen. Those are the rows. I want to draw your attention to the last column. This is the average net revenue per entity type. And you can see some of the figures that we have talked about: acquisition cost, operational cost, and reimbursements. But when you net that all out and average it by entity, you can see a huge variation across the state. Those general acute care hospitals on average generate around $47 million in net revenue in a year. And there's an incredible variation even still within that group. But then you compare that to some of the safety net federal grantee or disease-specific federal grantee clinics who are less than $500,000 a year. And you can see, so we are talking sometimes at the aggregate here, but know that there's an incredible variation depending on the provider behind that. So 340B looks very different for different providers across the state. Few other findings to highlight. The prescriptions filled by patients who are covered by Medicare or commercial plan account for 80% of the net 340B revenues in Minnesota. We also see that for every $100 in gross revenue, so when we don't account for costs generated, covered entities paid approximately $10 to external organizations. This highlights the role of intermediaries in operating the 340B program. So again, $137 million went to intermediaries. Providers spent about $28 million internally to operate their own 340B programs. But the portion of revenue spent on operations and the amount varies widely across different types of providers. Sometimes there's what you would call like one-time costs that are unavoidable, and when you have a smaller program, that accounts for a larger portion, therefore. A few notes on other things that we include in the report, deeper dive into drug level findings. We have a policy landscape section. There's entity level net revenues. This is statutorily required. So we can see here is a list. In the report, there's 25 providers that account for 90% of the statewide net revenue. Those are listed. Here you see the top 8, and they are all hospitals and one hemophilia treatment center in those top 25. Again, I've mentioned that the statute requires hospitals to report on some at the drug level. So they are required to report their top 50 most dispensed drugs. Altogether, these account for about 16% of the statewide gross revenue. Generally speaking, higher cost drugs yield higher net revenues. You think just higher purchase point, higher reimbursement point. That difference between the two is the net revenue once you account for costs. And so more opportunity there for the providers. National data show that specialty drugs account for 40% of the 340B units purchased, but 60% of the dollars spent to acquire those drugs. So just another example of how the high-cost drugs have a disproportionate effect in the 340B program. Finally, a small number of drugs account for a large share of the 340B purchases and revenues. So again, there's a lot of themes here. There's some just heavy hitter drugs in particular. And we can see 5 of those here. So these are the top 5 by gross revenue. Gross revenue is like net revenue, but doesn't account for those costs. So we don't have costs distributed at the drug level. And here you can see what are probably familiar names, Trikafta being number 1 and Humira being close second. These 5 drugs together account for 6.5% of the statewide gross revenue, and together generated about $100 million in gross revenue in 2024. Just a couple concluding thoughts before we wrap up. In many ways, 340B is an example of complexity in healthcare. It is a large program, but limited transparency. It's difficult to know the scope There's complexity that requires a lot of intermediaries and support and operational costs to track and ensure everything goes appropriately. And once established, which this program is, it develops its own dynamic. It becomes a commercial opportunity, especially for intermediaries, and it is very well established and a lot of integration in the system. Last thought is this report and the transparency that Minnesota has begun has seemingly created some momentum. More than a dozen other states have since passed some sort of 340B transparency initiative or data collection to better understand the role of 340B in their communities. Thank you.
Thank you very much. Members, do you have questions about any aspect of what was presented today, or questions about the 340B in general or the rest of the report? No? No? Very quiet. I think, you know, for me, this has been helpful to understand, you know, just how much revenue is involved, and I hope that we can keep looking at, you know, what other ways could we use this information to understand our system better. We are always, you know, we talk a lot in our committee about costs and where parts of the system need additional funding and need to be supported. But we also have, I think, kind of a lack of data on how all the different parts of the system are working. And so I appreciate having this report. I think there are things we could do to, you know, go from here. And I don't know if you want to comment at all about ways that policymakers could make use of the information. I know you do have some of the ideas in the report, but if you wanted to make a comment about that, I'd appreciate it.
Yeah, Madam Chair, thank you for that question. We don't have a set of recommendations. The administration does not have a set of recommendations. But it's fair to say that this program sort of engenders a lot of passion because there's a lot of stake for manufacturers in their perceived loss of revenue, for providers in a source of revenue, but also PBMs in how they set prices, and pharmacy chains and how they benefit from negotiating with Minnesota providers so they can provide patients who in Arizona fill a script, get an opportunity, have a payment for supplying 340B resource to those patients. So I think with the last point that Ms. Stieber made, the program has developed its own dynamics and driven financial incentives. It's essentially a policy questions to you, whether you want to better understand certain dynamics, how they play out in the practice, or to what extent these incentives are inconsistent with your values for the operation of the system. There are a lot of questions. This study focused, though it was very intense and focused on a lot of detailed data, it still remained at a fairly high level in that we only focused on the transaction price and the reimbursement. And so there are a number of downstream questions about how does the opportunity, how does the commercial opportunity, the financial incentive drive prescribing? How does it drive consolidation, seeing that affiliated sites can generate revenue? with a program that big and that complex and out of the reach, in some ways, of state policies, there are a lot of questions. We're not sure that we have a single recommendation, but happy to talk with you more about either refining the data collection system. I think last year we spoke a little bit more about payer level revenue, giving you a sense of the extent to which Medicaid, Medicare, and commercial patient generate a revenue. We could not do that in this report. If that's of interest, we can refine our approach in the coming years. But the ball, so to speak, is in your court, but we're happy to provide TA if that's of interest.
Okay, any other questions? I don't see any others, so thank you very much for your time and for presenting today.
Thank you, Madam Chair.
And now we will move to, we have several bills on the agenda that relate to food and food insecurity. And first we will go to Senate File 3770, Senator Boldon. Senator Boldon.
Thank you, Madam Chair. And members, we are at a crisis point when it comes to food insecurity. We have had conversations about that in this committee before and will again today. Food banks are form the backbone of the hunger relief system, but currently receive no ongoing funding from the state. The Regional Food Bank Grants Program would provide new and reliable source of funding for these critical partners in the fight against hunger. 1 in 5 Minnesota families cannot afford the food they need for themselves and their families, 20% of Minnesota families. This legislation would make a meaningful difference for the hundreds of thousands of Minnesotans experiencing food insecurity throughout the state, in every one of our districts. Minnesotans visited food shelves more than 9 million times last year, making 2025 the 4th record-breaking year in a row for food shelf visits. Food shelves and food banks have been sounding the alarm for years, as we have heard in this committee, as demand for emergency food assistance continues to rise while funding and food donations decline. Minnesota's Hunger Relief Network is at a breaking point after years of high and rising demand for emergency food. Food banks can stretch state dollars further because of their purchasing power, meaning more food, much of it sourced locally, will make it to our neighbors' tables. Food shelves are also struggling right now. While these funds would provide an infusion of much-needed food, further investments in Minnesota's food shelf program would allow individual agencies to cover the costs associated with staffing, food storage, transportation, and other unmet needs. These investments alone will not meet the entire need, but given the limited resources available this session, it would provide much-needed food to our neighbors and help ensure that fewer people go hungry in our state tomorrow. Despite continued economic growth, hunger rates are at an all-time high. We have a responsibility to act. The investments made last session are helping, but more needs to be done. This legislation would make a meaningful difference for hundreds of thousands of Minnesotans experiencing food insecurity. And with that, members, I will turn it to testifiers.
Senator Boldon, I do have an author's amendment. Would you like to move that before we go further?
Yes, Madam Chair. I do have the A1, which is a technical amendment, which was provided by Council.
Thank you. Members, Senator Boldon offers the A1 amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail and the A1 is adopted. And now moving to testifiers, I have Shay Morris and Virginia Witherspoon. Whoever would like to go first, if you could state your name for the record and begin your testimony.
Chair Wickland and members of the committee. My name is Shay Morris, and I'm President and CEO of Second Harvest Northland. We acquire and distribute nearly 11 million meals annually within our 15-county, 27,000 square mile, mostly rural service region, which includes 11 northeastern Minnesota counties. Last year, our Minnesota neighbors made over 9 million visits to our state's nearly 500 food shelves. That's not a number we're happy to share. Recently, high inflation, the end of temporary federal supports, mostly pandemic-related, and the government shutdown and SNAP pause have impacted working families, seniors on a fixed income, and neighbors with disabilities. In fact, when the government shut down last fall and SNAP paused, our region's food shelves, experienced a 16% increase in use, an immediate 16% increase in use. 26% of the neighbors that visited food shelves at that time reported that they'd never used a food shelf before. One such neighbor, Ann, a working mother with 2 children, shared, with SNAP being paused, I didn't have a reliable way to feed my kids. I learned about the food shelf, and it helped fill the gaps with nutritious food. We know that more recent changes to SNAP means that demand will remain high, and more families like Ann's will need our support. In a perfect storm scenario, our food bank started its fiscal year in July facing an estimated 1.3 million meal shortfall due to federal and state food and funding reductions. Increases from donated food sources like retail grocery stores or farms simply can't fill this gap. While government support makes up only 10% of our budget or resources, it's a critical safety net for the neighbors that we support. Why is this legislation a vital investment? We need reliable and consistent base funding so we can be available when our Minnesota neighbors need us most. For our food bank, we started in the early 80s during a recessionary period that hit the Iron Range particularly hard. With thousands of miners out of work, our food was a critical safety net for their families. Food banks remain an integral part of Minnesota's hunger relief system. We have been a reliable source of food for our food shelf partners and our neighbors for nearly 45 years. In fact, they report that 70 to 90% of the food they distribute in their local communities comes from our regional food banks. Minnesota food banks have a long history of responsibly managing the funds entrusted to us, upholding a high standard of transparency and accountability. While one-time support has been extremely helpful, base support will ensure reliable and consistent food to our nearly 500 Minnesota food shelf partners and the hundreds of thousands of neighbors we work together to support. I'd also like to add that we support our food shelf partners bill. We know from experience that the hunger relief system works best when we work together to support our neighbors facing hunger. I ask that you please support this bill to ensure our food is available, again, when our Minnesota neighbors need us most. Thank you.
Thank you. And if you could please state your name for the record and you can begin.
Chair Wickland and members of the committee, my name is Virginia Witherspoon, and I'm the Executive Director of Channel 1 Regional Food Bank located in Rochester, Minnesota. We serve 13 counties in southeast Minnesota. All of them outside the city of Rochester are rural areas. Last year, we distributed 15,834,000 pounds of food through more than 100 partner agencies. Food shelves, meal programs, and community organizations that rely on us as their primary source of food. For many of those partners, Channel 1 food from our warehouse is 80 to 95% of the food they distribute. So that means that your local food shelf in your district or hometown, most of the food there is coming from a food bank like ours. Demand in our region has grown dramatically. Over the past 3 years, we've seen a significant rise in neighbors seeking food assistance from working families, seniors on fixed income, and people with disabilities who are just doing their best to get by. When the SNAP pause hit last fall, we felt it immediately. At our food shelf alone, it was 200 additional people shopping a day the second they got that text message or email informing them they may not get SNAP. The food shelf visits surged, and many neighbors who rely on food stamps to bridge the gap in their grocery budget were in extreme stress, and they relied on us. During the gap in SNAP funding, Olmsted County turned to Channel 1 to provide food to impacted families. We immediately sprang into action and were able to leverage our network to order enough food for 10,000 emergency boxes, shelf-stable, fresh and frozen, bring in refrigerated trailers, and distribute the food simultaneously at 6 locations across the county. We partnered with the county to use its vaccine registration software to register people for a location. We recruited over 600 volunteers in a 4-day time period to assemble and distribute the boxes. The most popular pickup site was not the county fairgrounds as we anticipated, but Think Bank headquarters. The bank agreed to let us use its large parking lot as a pickup area, and the bankers volunteered to load boxes and direct traffic. The volunteers were humbled seeing hundreds of cars lined up for food. I share this story because food banks are what brings everyone together in a community. What makes regional food banks like Channel One so effective is our ability to stretch every dollar. Through our partnership with Feeding America and the 3 other regional food banks in Minnesota, we have significant purchasing power and the infrastructure to accept large donations, fresh, frozen, and shelf-stable, and distribute large quantities of food quickly across the state. Every single county, almost every single small town. The food bank is where the community comes together, people who need help, volunteers who have help to give, and food, money, and time given by businesses and rescued from stores. And yes, some government support too. But reliable impact requires reliable funding. State and federal support currently makes up a small fraction of our food bank budget, 12%, yet serves as that critical foundation. One-time grants help, but they don't allow us to plan, hire, and stock shelves consistently or show up for our partners when a crisis hits. Base funding does. This bill creates a regional food bank grant program that provides a steady stream of support so that food banks across Minnesota can keep shelves stocked and nimbly respond when emergencies arise. The proposed formula prioritizes areas with high poverty and unemployment, which is exactly the right approach for making sure communities like ours aren't left behind. We also fully endorse the bill to support food shelves as well. We're asking for a partnership from the state that reflects the scale of the need and proven effectiveness of the regional food bank model. I urge you to support this bill. Thank you.
Thank you very much. Members, do you have questions about this bill? I don't see any questions or comments. Thank you, Senator Boldon. I think, it's clear that the need is there, and having recent experiences that, both of you are able to capture kind of the immediate impact of sudden changes, and we know that this problem will probably increase over time now due to SNAP changes and eligibility, and so it seems like it's probable that you're going to continue to have growth and need. So, Senator Boldon, any final thoughts?
Thank you, Madam Chair, and thank you, members, for considering this bill. I think you're exactly right. We know this need is going to grow. It has been growing for years past, and we continue to see that. We know with SNAP changes coming, families are squeezed in many parts of their budget right now, and food is just one of the very basic needs. I don't know if any members on this committee have been food insecure in your lives, and I won't ask, but I would ask you to think about what that would mean and what that would look like in your life if you were worried about how you would feed your family. And so having predictable, reliable resources for this very basic need for Minnesotans across the state is more and more necessary every day. And so thank you for considering.
Thank you. And with these bills today, we were going to be laying them all over for possible consideration in the future. So Senate File 3770 as amended is laid over. Thank you. Thank you both for coming. Next, we have Senate File 849, Senator Maye Quade. Welcome to our committee, and please proceed. Is this? Okay, was checking. We do have an amendment, but this bill has been heard, so I don't, as part of your presentation, if you want to let us know about the amendment as well. Thank you.
Sure. Good morning, Chair Wicklund, members of the committee. I'm so happy to be back talking to you about Senate File 849 regarding funding for Minnesota's SNAP Outreach Program. The SNAP Outreach Program supports the work of organizations across the state, helping enroll eligible individuals in SNAP. It is a key connector to Minnesotans navigating the complicated SNAP assistance process, ultimately ensuring program compliance and increasing access. Senate File 849 as amended, if we do amend that, would restore lost SNAP outreach funding due to the impacts of H.R. 1. As you may already know, prior to H.R. 1, the USDA provided a 50% reimbursement rate to eligible organizations for SNAP outreach activities. Starting October 2026, the USDA will only provide a 25% reimbursement rate, and this will result in our community-based organizations having to spend more money to do the same amount of work. If there is no additional funding for the program, we expect that organizations will need to reduce their SNAP outreach activities or end their program entirely. If that happens, there will be less support for people applying for SNAP, less resources for SNAP outreach community partners, less opportunity for fraud prevention, and increased payment errors. SNAP outreach is completely trusted. It's completed by trusted community partners who are skilled plain language translators that help people navigate a very complicated system. When high-quality support is provided, Minnesota can improve our case accuracy, reduce payment errors, support our local economy, and ensure Minnesotans are connected to the food support that they need. Minnesota currently provides about $500,000 in state funding to support SNAP outreach activities, and investing an additional $1.75 million in state funds will replace the loss of reimbursements at the federal level. We really cannot afford to lose this program right now. In a time where 1 in 5 Minnesotans are food insecure, funding SNAP outreach is imperative. And I will just add that I got a demonstration from my county over the interim on what SNAP applications look like, how people fill them out, and then how it goes into the system. And that plain language translator is so vitally important. Some of the questions are very confusing, and even an earnest response could be inaccurate and can lead to an error rate, which could be very costly for our county. So these are vital folks in our communities helping make sure that we have the right people eligible for the right amount in SNAP and just work for everybody. So thank you, Madam Chair.
Thank you. Did you want to speak to the A3 amendment? Just what it looks like it's an update to the bill, but if you could say a few words about that.
Yep, so the amendment, Madam Chair, is just replacing that lost funding that we would normally be receiving from the federal government that they cut to keep our SNAP outreach program to where it is, where you generously funded in your bill last year.
Okay, thank you. And members, just for your information, I didn't mention before, but two of these bills we did hear last year, and we decided to hear them again today because, as Senator Maye Quade has mentioned, things have changed since we adjourned last year. We have new realities, and we wanted to make sure that we had these different bills in consideration this year if we're able to provide any funding. So, and let's see, do you want to have discussion about the amendment first and then do have your testifier speak, or?
That would be great, Madam Chair.
Okay. So first, Senator Mann will move the A3 amendment. Members, do you have any questions or comments about the amendment? Okay. Seeing none, Senator Mann moves the A3 amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail, and the A3 amendment is adopted. And now we have a testifier, Tina England. If you could please state your name for the record and begin.
Thank you, Chair Wickland and members of the committee. My name is Tina England. I am the Neighbor Services Operations Manager at Second Harvest Heartland Food Bank, where I've worked for 12 years. We are pleased to support SF 849, which would maintain funding for the statewide SNAP outreach program, mitigating the cuts made in H.R. 1. I'm a veteran of the United States Navy and have lived experience with SNAP both as a child and as a single parent. I'm a 30-year resident of Waseca in south central Minnesota. I've run a food shelf in greater Minnesota, and I've been a county worker. We, Second Harvest, are one of the 28 outreach grantees in the state, and together we cover all 87 counties. This funding supports all SNAP outreach grantee organizations. In 2025, SNAP outreach grantees like Second Harvest Heartland supported the completion of nearly 35,000 SNAP applications and recertifications. You've heard about the importance of lowering and maintaining low error rates. SNAP outreach from trusted community partners can help reduce errors. SNAP outreach grantees, like the team I supervise, for example, provide one-on-one application assistance. This could be completing the 10-page application referenced, could be explaining what supporting documents are needed, things like pay stubs, child support income, proof of disability. We explain how the process works, and applying for SNAP is a process. We make sure neighbors applying to the program understand there is a mandatory interview. There are deadlines to be met. There are reporting requirements, and so on. Our ability to be partners in accuracy will be diminished as funding is reduced. This could mean some of those 35,000 or so applicants, neighbors who we assist now, clog up phone lines with questions about the application process, rule changes, or asking about the differences between programs to even know what to apply for. Questions we answer now. This could mean more incomplete forms or missing documents, which adds processing and handling time for county workers. They're already working within a strict framework of deadlines. All of these things could lead to higher payment error rates. SNAP outreach grantees are a crucial link, helping applicants accurately report and stay connected to their benefits, in turn helping county workers. With new work requirements and other HR 1 changes to SNAP, SF 849 would ensure Minnesota SNAP outreach remains strong. We respectfully ask for your support and thank you for your time.
Thank you very much for your testimony. Members, do you have any questions or comments about the bill? No? Seeing no questions, Senator Maye Quade, do you have any final thoughts that you'd like to share?
No, Madam Chair, I'll take the no questions as I did such a fantastic job explaining it with my testifier. So I'll just leave my comments where they are, and I appreciate the committee's consideration.
Thank you. This does seem like an area where we will, as a state, want to, preserve the ability to help people as they are navigating this process. And we will be receiving fewer resources federally. So I hope that we can consider this as we go forward, making sure that we have that strong outreach program. So thank you. And Senate File 849 as amended is laid over. Thank you. And next we have Senator Kupec, Senate File 1412. And members, this is another bill that we did discuss last session, and so there is an amendment in your packet, and I'll let Senator Kupec, if you could discuss the bill and maybe talk about the amendment as well.
Sure. You want to do the amendment first, Madam Chair?
Why don't you talk through the bill and what the amendment does?
Sure.
And then we can
okay.
Take it up.
So yes.
Senator Kupec.
Thanks. As stated before, this is a bill that we did have last year in committee. 1412 would provide an additional 1 year of funding for the current Prepared Meals Grant Program that is administered by the Department of Children, Youth, and Families. Prepared home meals are a critical lifeline for many of our state's most vulnerable individuals, whether that be to a disability, chronic illness, limited mobility, or those experiencing a family crisis. Prepared meals are interventions with the most well-documented return on investment. We know firsthand the impact of access to food on an individual, family, mental, and physical health. And these are they're a unique kind of mix of the food bank, food shelf services, particularly those people who have either dietary restrictions from an illness or coming out of the hospital or for religious purposes. These are kind of a vital lifeline for those patients.
Thank you. And then the A3 amendment, it looks like just makes a couple updates and then replaces the appropriation section. Is that?
That is correct, yes. Council had a couple of technical updates that are the first couple of lines, and then obviously there's an update to the ask for the dollars.
Okay, and Senator Kupec moves the A3 amendment. Is there discussion or questions about the amendment? Seeing none, all those in favor of the A3 amendment, please signify by saying aye. Aye. Any opposed? The A3 amendment is adopted. And now we will move to your testifiers. We have Leah Hebert Wells and Faisa Ali. If Ms. Wells, if you would like to go first, if you could state your name for the record and begin.
All right. Thank you. Good morning, Chair Wickland and Ranking Member Utke and members of the committee. My name is Leah Hebert Wells, and I am the CEO of Open Arms of Minnesota. I'm here today because Senate File 1412 can change and save lives, and I want to tell you why. For nearly 40 years, Open Arms has prepared and delivered medically tailored meals from our kitchens in Minneapolis and now St. Paul as well to clients across the state of Minnesota. Every week, we prepare and deliver more than 20,000 meals to clients living with HIV/AIDS, cancer, ALS, MS, kidney disease, heart failure, and COPD, all free of cost to those people and all tailored to their medical needs. Our clients simply cannot go to a food shelf and grab whatever is on the shelf. Prepared meals are a critical piece of the food insecurity safety net in Minnesota. A client on hemodialysis needs specific levels of protein, potassium, and phosphorus. A client with critical cardiac issues must be on a DASH diet. A client with ALS may need every meal pureed. The intersection of serious illness and food insecurity is its own crisis, and prepared meal organizations like Open Arms are uniquely equipped to address it. Senate File 1412 would continue funding for a grant program to support nonprofits providing these prepared meals. This grant program currently provides funding to Open Arms to ship meals that we make in our two kitchens to clients from Minneapolis to Wilkin County, from Duluth to Glencoe. Clients served by this program are veterans, parents, teachers, and farmers who are knocked down by a cancer diagnosis who simply need reliable, nourishing food while they fight to get back on their feet. Open Arms needs this funding to sustain the services we currently provide. The requested appropriation is what it takes to maintain our current level of service, and without it, we will face difficult choices about which critically ill Minnesotans we can continue to serve. When a box of homemade, medically tailored food arrives at somebody's door, it tells them they're not forgotten. That matters enormously when you're fighting for your life. I urge you to support Senate File 1412, and I thank you for your time.
Thank you very much. And Ms. Ali, if you could state your name for the record and you can begin.
Good morning, Chair and committee members. My name is Faiza Ali, and I'm here with Fairview Health Services. I work as a food resource navigator. In my role, I work with patients who screened positive for food insecurity, and I talk with them about county food benefits, community food resources, as well as connect them to programs through Fair Table, which is our Fairview Food is Medicine initiative. Our Fair Table program options include fresh food box prescription, shelf-stable food bags at the clinics, vouchers to purchase healthy foods, community-based food access programs, and medically tailored prepared meals. My job is to help patients understand the options available to them and connect them to a level of support that is the best fit for them. One of our most impactful supports that we offer that's very specific is our prepared meals programs in partnership with Open Arms Minnesota. As current funding recipients, we are able to provide medically, culturally appropriate meals to patients who are food insecure, living with chronic medical conditions, that have disabilities and limited mobility, and other barriers to getting and preparing healthy meals for themselves. We also offer meals to caregivers and dependents, which helps support them and the entire family. This service really makes a difference in the patients we serve. Some patients I've worked with that have been impacted by this program is a patient I worked with who's being treated for cancer currently, as well as cannot work at this time due to the constant medical appointments and her health condition. And on top of that, she's only leaving her house for medical appointments due to the community safety concerns in the Latinx community. She's receiving food only from Fairview, which is helping to sustain her. And another patient I worked with had multiple health conditions, including a rare form of cancer, and him and his wife are really struggling to find and get connected with resources. Being through the Fairview program, he's able to receive meals that support his health and has significantly reduced caregiver stress for his wife, who's caring for him and also dealing with her own health challenges. And even on the younger side, a patient I've worked with who's in his 30s, has a family history of cardiac conditions and now dealing with his own issues. He had to have a heart surgery that takes him out of work for months in recovery. He was going through his savings to support himself and his family. So being connected with the Fairview Food Program helps him to receive meals that support his recovery and make more out of his food budget. Being able to offer prepared meals allows me to provide patients with such unique circumstances a resource they wouldn't be able to find otherwise, and helps me support patients and their families' health and mental well-being. We're seeing within our healthcare system and across national research, prepared meals improves health outcomes, disease management, and increases patient engagement in medical care, reduces the strain on emergency and acute services, and overall reduces cost of care over time. These programs also strengthen Minnesota's broader hunger relief and community support systems to work together to use resources appropriately and reach the patients that need it the most. Continued funding is essential to sustain this work. Without ongoing investment, programs like this will scale back or disappear, leaving patients without much other options to support their needs. However, with continued funding, we can build on what's already working. Thank you so much for allowing me to share what Prepared Meals programs means to me and the patients and families I serve.
Thank you very much. I had a chance last fall to go visit the Open Arms location in St. Paul, and it was really impressive the way that you were able to accommodate volunteers to help with the food packing, and then to accommodate so many different variations on the meals prepared. It was really an interesting experience.
Thank you.
Members, do you have any questions? Senator Utke.
Thank you, Madam Chair. And to the bill, and a question for Senator Kupec. This was a new proposal last year. It got funded, I believe, with one-time monies for this year. Any feedback so far on how it's been going? How much money has been expended, put out into the communities? Any of that?
Senator Kupec.
Yes, and I believe in your packet too here, there's a little article about where the money has gone and which organizations have put it out, and how many people have been served by that. So 750,000 prepared meals were done, I believe, last year. Or that's what it was delivered with. If we had done the one-time funding last year, we did not do it last year for the 1 million, I believe. Is that correct on the last one? Or would deliver, I'm sorry.
Do you remember the amount that was in the budget? I don't have that listed here, so. 1 million, okay. I'm being told it was 1 million
Right.
last year.
And it's 750,000 meals for that $1 million.
Senator Edke?
Thank you, Madam Chair, and thank you. It's, right, it looks like we had 1 million last year, which would be being spent this year. Now we're looking for 5 million going forward. So it maybe is premature, but any plans on how it expands to that level? Or I guess we're going to find out if this is a whole lot of spending. I know this is going to be a challenge anyhow, but at least it's before us.
Senator Kupec.
Sure, and I think we were looking for more money last year, and it got pared down to that. So, but if you, I don't know if any of the testifiers would, if you had more money to expand upon this.
I mean, what I can say is that we have people waiting, and of course, for our allocation of what's going around the entire state of Minnesota, the grant that we get, we're able to serve only about 50 people a week. And we know that and I'm sure you all know, serving people with cancer, heart disease, HIV, people in dialysis, there's a lot more than 50 folks out in the state of Minnesota that we could serve. So we know that there's just a huge, huge need, and believe that we could help meet that need with more funding.
And Ms. Ali, with Fairview, do you have waiting lists for your programs? If you could comment on that.
Yeah, so because of our Fairview program, we only have a limited amount of space. So we also have wait lists for patients that I work with, and I'm like, oh, they would be such a good fit for prepared meals, but unfortunately we don't have space.
Thank you. Senator Radke?
That's all. Thank you.
Okay. Thanks. Any other questions or comments about the bill? Seeing none, Senator Kupec, any final thoughts?
It is always, we did this, I think this is the third time I've been before this committee with this bill, because we did it back in 2023 as well. And it is always amazing to me. There are little places that pop up, and when they find out that I had carried this bill, like, oh, we were able to utilize some of that funding too in a unique way. So it touches, I think, a lot of lives within the state of Minnesota, and there are very unique cases, particularly, I think, around, people who have health disabilities that do not allow them to get out to a food bank. So I think it's there, and I think with a little bit more funding, we could touch a few more lives in the state as well.
Thank you. With that, Senate File 1412, as amended, is laid over. And next, we'll go to Senator Mann, Senate File 3904.
Thank you, Madam Chair. 3904 strengthens a longstanding Minnesota food shelf program by updating its base funding to match current demand. I don't really need to beat this dead horse, but the demand remains historically high. Food shelves recorded more than 9 million visits last year and more than double pre-pandemic levels. What was once viewed as a temporary emergency has become a sustained reality, and our response must reflect the scale and urgency of that need. With that, I'll go to my testifiers, Madam Chair.
Thank you, and welcome to the committee. If you could state your name and begin your testimony. And Ms. Lehman, if you would like to go first.
Oh.
Either way, you can decide.
Thank you, Madam Chair and members. My name is Stephanie Lehman, Executive Director at ACBC Food Shelf. ACBC Food Shelf, serving Anoka County and surrounding areas, has been providing food, clothing, and resources to households for 55 years. In 2020, we had 9,400 food shelf visits. In 2025, we had over 27,000. This is a 187% increase in just 5 years. Our communities need us now more than ever. In Minnesota, 1 in 5 households cannot afford the food they need. We all know someone struggling to make ends meet. Working families not making a living wage, seniors on a fixed income, single-parent homes, people experiencing a health crisis or loss, caregivers, and more. Every person's situation is unique. However, the need for food remains the same. We have a mother who has been coming to us for food support. She has a husband and 2 children. Her husband is a veteran and she has cancer. They never envisioned the food shelf as a place they would need. For them, we are temporary, but we are necessary as they navigate through their crisis. We hear stories like this every day. Coming to the food shelf not only ensures people have access to food, but for some, they can then pick up a much-needed prescription or put gas in their car to drive to work or pay for their rent. Food support creates breathing room when families have none. We are still hitting record numbers every day. In the first 2 months of this year, we have fed nearly 16,000 individuals. That's a 38% increase over this time last year. Like our increases in households served, our budget and food expenses have grown proportionately. It is expensive to purchase food, not only for our participants, but for our organization. Due to reductions in food resources and the rising food costs, we have already spent an increase of 104% this year to ensure households have access to healthy food options. We are so thankful for funds received through the Minnesota Food Shelf Program. Although we work hard to gain new funding opportunities and partnerships, the reality is the need is outpacing the resources available. We are asking that you please consider the funding increase to the Minnesota Food Shelf Program so that food shelves can continue to help strengthen the community through food and support and continue to meet record high levels of need. We can only solve this hunger crisis together. Thank you for your time and consideration.
Thank you very much. Mr. Nair, if you could please state your name for the record and begin your testimony.
Thank you, members of the committee. It's nice to be with you this morning. Can I just say ditto? My name is Dan Nair, Executive Director of ICA Food Shelf with Wraparound Services of Employment and Housing. Relationships have historically been built around the table where family and other invited guests gather to share a feast. It's where we teach our children and our neighbors the moral values of our collective community and decide how we can take care of one another. In this meeting today, and I invite you, each of you, to envision you are all sitting at the table and looking at the feast of resources we need to make sure tables have food. Right now, we are kind of living in a perfect storm, as the rise in demand for food resources is not keeping pace with all those missing from that table. For the Food Insecurity Network, it feels like we are navigating a paradigm shift that is bringing permanent structural shifts, moving towards a primary shopping experience for a lot of our families from a supplemental program, which we're set up and meant to be designed for. In the past 5 years, 2020 through 2025, which my colleague to my left has mentioned, ICA has witnessed an 89% increase in the number of visits coming through our food shelf. In the SNAP crisis this past fall, ICA experienced a 35% increase in the number of visits. In the past 7 weeks, ICA has delivered over 2,000 emergency full food orders for families afraid to leave their homes, go to work, or visit their own local grocery stores. In the past month, ICA has witnessed an increase in 7 times our monthly average rental and utility assistance for families in our area. As I look at the trends and analysis of our work over the course of the past 5 years, the list of external factors affecting our work continues to be placed on the backs of the nonprofit sector. One of those stats that keeps me up at night is the Department of Ag is predicting that meats, seafood, fruits, vegetables, and baking goods will typically grow faster than their 20-year historical average in 2026. Couple this with the rising demand for housing assistance, the sustainability factor feels like it is diminishing. ICA Food Shelf, our #1 mission in our community, is to provide emergency assistance to help families provide a sense of stability, as not to live a life of daily chaos, wondering where their next meal will come from, or if they have a roof over their heads or even have that meal. The Food Security Network plays a vital role to move families forward on a path to achieve self-sufficiency. We can't continue to do this alone when the feast is unequal. While we sit here today, thousands of families across our state are looking at empty tables. If history is truly built on sharing our feast, we must ask ourselves, who is being left out? As the demand continues to rise, funding dollars need to follow. Without those dollars, the food security system will continue to weaken and more people will experience hunger. I implore you to work together to give us the means to support those who will grow more hungry and gather around an empty table. Thank you.
Thank you. Thank you both for your testimony. Members, do you have any questions about the bill or comments? Seeing none, Senator Mann, any closing thoughts? I'll just say I think this, it's another component of our food system, and we need to pay attention to all aspects, as you mentioned, to make sure that we're fully serving people in need. So thank you very much for your testimony today. And Senate File 3904 is laid over. And Senator Mann, you have 4061.
Thank you, Madam Chair. 4061 honors Minnesota's commitment to veterans, seniors, Minnesotans experiencing homelessness, youth aging out of foster care, new Americans, working parents who have experienced a job loss. This bill would support Minnesotans at risk for losing access to federal SNAP benefits due to the rather cruel changes coming from the federal government. That will kick people experiencing homelessness, youth aging out of foster care, new Americans, working parents who have experienced an injury or job loss, seniors and veterans off of food support. Minnesota SNAP bill does three things. It creates a state-funded bridge to provide food support benefits to Minnesotans losing SNAP. It creates time and space for counties and tribes and state-approved navigators to meet with Minnesotans to determine whether they should be eligible for federal SNAP under an exemption. And it ensures that Minnesota is capturing all potential federal dollars for eligible Minnesotans, but also ensures that our community of veterans, seniors, and people experiencing illness are not falling through the cracks of a new, purposefully complicated and punitive federal system. With that, Madam Chair, I'll go to my testifiers.
Hi.
I have a couple testifiers listed, but please, if you could state your name and proceed.
Hi. My name is Melissa. I'm from Minneapolis, and this is my SNAP story. In June of 2017, I was working 60 hours a week as a self-employed hairstylist while attending school. I refused to take out student loans to work my way to pay my tuition. After being hospitalized for acute appendicitis, I lost $4,000 in income and had no money for food. Ashamed to ask for help, I went 4 days without eating. Eventually, I asked for help at my college where I've received assistance to apply for SNAP, and I was awarded $23 per month in SNAP benefits. This helped buy eggs and basic protein, and that assistance kept me in school. In fall of 2021, after 3 years of trying, I became pregnant. The application process for assistance was exhausting. Multiple applications, phone calls, and caseworkers during a difficult pregnancy. After 3 applications and 2 caseworkers, I finally gained access to support. 2 months after receiving cash assistance and SNAP benefits, I stopped completing the necessary paperwork to receiving cash assistance. I was spending 6 to 9 hours every month keeping track of information needed to submit my paperwork and contacting administrative services by phone to ensure my benefits would continue. This process was too taxing to be worth $50. At the time, I only had to renew my SNAP benefits every 6 months, and I learned to be overly thorough with my paperwork, submitting it in multiple ways and keeping paper copies for myself. In fact, one SNAP administrative worker told me I was doing too much and to stop sending in so much paperwork, as I had been filling out the wrong renewal application. He helped walk me through the correct one while on the phone with me. Throughout this process, I continued to work 40 hours a week. Navigating the SNAP application and renewal process is hard. In February of 2025, I married my high school sweetheart, and with our earning power combined, we were able to thrive without further assistance from SNAP. Just last month, my husband fell on the ice and fractured 2 ribs. He is unable to work for at least another 2 weeks. Although we have applied for short-term disability, he has not yet been approved. The thought of going through the SNAP application process all over again is daunting, especially with the new 20-hour work week requirements. As a self-employed hairdresser, there is no guarantee that my child, my client, or I will not get sick and I'll be able to work. There is no clear protocol for how self-employed SNAP recipients are supposed to document these hours. Food is essential for all ages to thrive, not just survive. SNAP keeps refrigerators full and allows families to pay rent and utilities. Even families with 2 full-time working parents are struggling in today's economy. Please protect and strengthen food assistance programs. They keep students in schools, families housed, and children nourished. Thank you for your time, Madam Chair and members.
Thank you very much for sharing your story. And I have Steve Barthel listed as another testifier. Welcome to the committee. If you could state your name for the record and begin.
Thank you. Good morning, Chair Wickland and members of the committee. My name is Steve Bartle. I'm Director of Government Relations for the Minnesota Grocers Association. The MGA has been proud to represent the state's food industry for more than 125 years. Today, our membership includes over 250 member companies operating 1,300 locations statewide who play an essential role in feeding families in every corner of the state. We would like to voice our support for Senator Mann's MnSNAP proposal and enhanced state efforts to bolster the SNAP program being considered in Senate File 4061. Our organization and members are proud to work with hunger relief partners like Second Harvest Heartland, the Food Group, and dozens of food shelves and food banks across the state to help our neighbors in need, but we know that the need is still great. You have heard from advocates today about the importance of a strong SNAP program for individuals and families, but we would like to highlight the economic importance of SNAP for local retailers. Approximately 12% of all grocery stores spending comes from SNAP beneficiaries. In 2024, Minnesota SNAP recipients spent more than $850 million with eligible retailers. The cuts from H.R. 1 would result in the loss of tens of millions of dollars that would otherwise be spent with local retailers. Local grocers are under extraordinary financial pressure. Independent grocers operate on thin margins of 1.5% to 2%, while facing increasing market consolidation by dominant big box retailers, rising labor costs, costly state mandates, tariffs, increasing property taxes, soaring energy rates, and escalating levels of crime, all of which are outside of their control. SNAP cuts compound these challenges for retailers and will accelerate store closures in both urban and rural settings, further expanding food deserts across the state, particularly in low-income areas where SNAP is most needed. We fully support the MnSNAP proposal to protect and strengthen SNAP as a cornerstone of Minnesota's fight against hunger and as a proven strategy to promote economic support throughout our state. Thank you for your consideration.
Thank you. And is that all of the testifiers? Okay. Members, questions or comments about the bill? Senator Atke, or did you? Okay, go ahead.
Thank you, Madam Chair. Just a couple questions on the bill language itself. On the first page, 1.16, where you talk about food benefits continuation, about the determination for eligible participants. Once they apply, are eligible forever? I mean, it just seems to be so open-ended. Is there more to come on that, or will it follow the current SNAP benefit program that we see from the federal government?
If you could please state your name for the record. And
thank you, Madam Chair. My name is Jessica Webster. I'm a staff attorney with Legal Aid, and I work in this area of policy. Senator, if you look at line 2.18, it says exiting MnSNAP. And so what this bill does is it sets up a rather robust assessment to look at what barriers to employment some folks might have that are veterans, seniors, homeless folks. And if someone in all ways can comply with the federal requirements and the time, and they can fall under the time limits, then they convert back to federal SNAP. And the federal SNAP rule is if you in all ways can meet these 80 hours a month, then you can get SNAP. You get federal SNAP, and if you can't, then you only get it 3 months out of 3 years. So if you have a veteran that has a traumatic brain injury, for example, and hasn't been able to verify their injury or hasn't been able to verify with the county, they're going to fall off if they're not meeting those 80 hours a month. And what this bill does is it says, oh, hold up, let's make sure that we fully assess this veteran to see if they can work and make the work requirement, make the time limits, fall under the time limit before we exit them. Does that make sense, Senator?
Senator Atke?
Thank you, Madam Chair. Yes. Yep. And then, Madam Chair, if I can, I got one additional question or a comment more. When I get to the end of the bill, we're proposing another program with one-time funding. We saw the results of that last year where there was a number of one-time programs or one biennium funding in 2023, and last year then all of a sudden these various organizations and people come to us saying, hey, you cut our funding. Well, we didn't. It was only one-time funding going in. It sometimes creates a lot of problems and a lot of controversy, just acknowledging the fact that it's one-time funding in this bill. And, you know, we, I guess, fully probably anticipate where this is going anyhow, but I think that's a bad precedence to even just show it in the bill as one time. But thank you.
Senator Mann, I did want to clarify, I believe Council was indicating that the program would be an ongoing program, Senator Udke, the way it's written. Ms. Hoffman-Latia, if you could let us know where that is stated.
Madam Chair, members, this is ongoing. Any amount appropriated in the second year of a biennium is ongoing for the purposes of that appropriation unless it states explicitly it's one time.
Okay, thank you. So, clarify. Okay. Senator Boldon?
Thank you, Madam Chair, and thank you, Senator Mann, for bringing this bill. I'm happy to be a co-author, and my comments aren't necessarily just specific to this bill, but I just wanted to make a comment about sort of all of the bills that we have heard today on the same theme of making sure Minnesotans have the food that they need. These are really impactful bills that I hope we deeply consider. The need is great, and we have a responsibility. You know, we sit here at a table and have these very formal conversations, and this is the process. But I want us to really be grounded and clear that we are making decisions about whether Minnesotans will have food to eat. That is a very real reality for people, and I just want us to be grounded in that and think about that. And I really implore us to make decisions that ensure people have what they need. And this bill in particular, thank you, Senator Mann, for trying to step into the gap that the federal government is now leaving, which will leave people behind and will mean people that do not have food to eat. One of the most basic needs there is. And so thank you for the work, and thank you, Madam Chair, for hearing these bills today. I very much hope that we can move on this issue.
Thank you. Senator Coran.
Thank you, Madam Chair, and Senator Mann. Could you, on the moratorium subdivision 6, just help me out with the second half of that moratorium, or the statement of the eligibility, where there's no current medical, behavioral health, or vocational assessment indicating the participant's ability to consistently comply with the federal requirements. Was that part of the answer? Or was, if they have no way to prove determination, or they just have, they're inaccessible, just unable to prove, so they would move on to the MinSNAP program? The state's going to pick up that funding? That's who's going to pay for the moratorium?
Ms. Webster?
Madam Chair, Senator Krantz, that is correct. So the way that this would typically work, or how it's looked coming out of COVID, when we lost waivers and we had adults all of a sudden subject to these new verification requirements, you might get a letter from the county that you never receive, and it says, you know, you're being terminated, or this is notice that you haven't verified that, you know, you're eligible. And so these paperwork crossing in the mail, people not getting notice. This is an attempt to say, let's make sure that folks who are injured, ill, disabled can get on the bridge for a minute until we can make sure that they have access to food, whether that be temporarily funded by state resources, or we're going to help you navigate to get an exemption to reconnect you to federal resources.
Thank you. And Madam Chair, I think in the MinSNAP, so you just described that we need to have a really robust eligibility determination, yet our counties don't have the tools, or at least said, to do the eligibility determination of the same one twice for the federal program. And so, Madam Chair, the question for you is, have you had any productive conversation with DHS or anybody involved? Because I think it really calls for a robust special project, IT-wise, and the utilization of the best data available to try and automate as much of that as possible. And I haven't heard anybody talk about that from DHS or anybody. We have challenged it, right? The systems aren't, none of that stuff's going to change for a couple years. the overall core tool sets that our counties have. So the robust determination is going to be done by who and by what and what technology. It would require the same type of project. And so have you had any great conversations? And if not, you and I should gather and figure out what that looks like and put together a framework. Our counties need it, no matter what, no matter Min SNAP program or otherwise, to make sure that we put forth something that aids the counties, that everybody that's eligible for benefit, we can guarantee they get it.
Thank you, Senator Corinne. Yeah, we've had conversations with the counties, and since SNAP is part of DCYF's kind of portfolio, then we've had conversations with them and with DHS, and because all the systems are kind of interrelated that serve SNAP and the other programs that counties have to administer. And so we are having discussions about what could we do short term to set up some key things that Minute and DHS and DCYF could work on immediately. And then how do we best position ourselves to be looking into the future, like what could be done to transform or modernize, whichever word you'd like to use, but to take that bigger step of like how do we move forward.
Madam Chair,
Senator
I would agree with short-term, midterm, and long-term, and we must build in highly automated ability, utilizing the best of data, and our federal partners in Minnesota. We need to standardize the eligibility determination across all the benefit programs, so each of those programs or the technology can be more effective, in addition to an automated manner. So they're truly dealing with just kind of exception-based type activities. It's been done, and my staff will schedule a meeting with you, and we'll talk about where it's been done in a couple other states. So thank you.
Yeah, happy to talk more about it. I think the counties and the people applying, and most importantly, the people applying would definitely appreciate if we could standardize across these programs and make it so that the eligibility process is not so overwhelming, and if it can be standardized across programs, I think that would really help. So we will definitely have that discussion. So Senator Mann, any other thoughts?
Thank you, Madam Chair. I just wanted to highlight what was said by the other testifier, and that was $23 per month. While the billionaires who run our country joke that one of them has enough money to buy Greenland, they turn around and tell us that the $23 per month that are keeping people from starving to death is what's ruining the country. So I just kind of wish that we would stop idolizing the hoarding of wealth and think about what that does in terms of people are starving while we idolize the hoarding of wealth. So just something to think about.
Thank you. And seeing no other questions or comments, I hope that we can have further discussions about this. I do think it's a good idea for Minnesota, for us as policymakers, to figure out, are there ways that we could step in where federal government is making changes that we don't choose to support, and we want to continue to support Minnesotans that need access to food. So I appreciate your bringing the bill forward. And with that, Senate File 4061 is laid over. And members, we've reached the end of our agenda, and we are adjourned.